stenosis symptoms occurs by hypertrophy of smooth muscles of pyloric sphincter causing projectile vomiting first few weeks of life, hungry baby, thin pale, FTT, hypertrophic powers like olive and abdomen after feeding, back hypocaloric metabolic alkalosis cause of vomiting, differences between gastroesophageal reflux, infants with high-powered stenosis typically benign, but vomiting during the first weeks of life, vomiting differs from spitting up because of extremely forceful and often projectile nature. The vomiting material never contains bile because the gastric outlet obstruction is proximal to the duodenum. This feature will differentiate pyloric stenosis from most other obstructed original. Early childhood pyloric stenosis occurs in the first 1 to 2 months of life and is characterized by steady worsening forceful vomiting that occurs immediately after feedings. The stomachs become massively enlarged with retained food and secretion, and gastric peristaltic waves are often visible in the left upper quadrant. On hypertrophied pylorus, olive may be pulpy. Classic laboratory findings is hypokalemic metabolic alkalosis with elevated band from secondary to dehydration. Plain abdominal X-rays typically show an enlarged stomach and diminished or absent gas in the intestine. A barium approach usually shows a string sign caused by barium through a elongated constricted pyloric channel. Pyloric stenosis, often seen in an infant of a few weeks old, is a condition where the pylorus also begin obstructing food from entering the small intestine. Here are typical symptoms. Gastrointestinal symptom, projectile vomiting, first full expression of milk or formula served fades away, occurring shortly after feeding. This is the hallmark symptoms. And constant hunger, infants may seem hungry frequently due to vomiting of their feedings. Physical signs, olive-sized mass, palpable in the upper abdomen representing the enlarged pylorus, visible peristalsis, wave-like movements of the abdomen after feeding as the stomach tries to first contest past the narrowed pylorus. Dehydration and flu-like imbalance dehydration signs such as fever, wet diapers, dry mouth, sunken eyes, or sunken fontanelle in the infant's skull, change in urination, increased frequency and volume of urination. Painless or failure to gain due to vomiting and inadequate intake, metabolic consequences, metabolic alkalosis due to loss of stomach acid, high hydrochloric acid from peristaltic vomiting, leading to an imbalance in the body's electrolytes, particularly characterized by low chloride and potassium levels, behavioral changes, irritability or lethargy depending on the severity of dehydration and electrolyte imbalance. Diagnostic approach, physical examination, palpation of the abdomen may reveal the characteristic olive-sized mass. Ultrasound or non-invasive test can visualize the thickened pylorus. Blood test to assess for hydration, dehydration, and electrolyte imbalances, especially metabolic alkalosis, and high endpoints of projectile vomiting in an otherwise healthy infant of 3 weeks old is highly suggestive of pyloric stenosis. This condition requires prompt medical evaluation due to the risk of dehydration and electrolyte imbalances. Treatment typically involves surgical intervention known as pyloromyotomy believed to relieve the obstruction, which is usually curative with an excellent prognosis. Pylorus stenosis symptom occur hypertrophy, muscle, pyloric sphincter cause projectile vomiting, first few weeks of life, hungry baby, thin, pale, activity, hypertrophic pylorus like olive on the abdomen after feeding, back hypocaloric, metabolic alkalosis, vomiting, gastroesophageal reflux. Infants with pyloric stenosis, benign vomiting during first weeks of life, vomiting differs from spitting up because it's extremely forceful and often projectile nature. To differentiate pyloric stenosis from most other obstructive relational earlier childhood, pyloric stenosis occurs in the first 1 to 2 months of life and characterized by steadily worsening. Forceful vomiting occurs immediately after feeding. Massively enlarged stomach retain food and secretion, gastric peristaltic waves. Often visible in the left upper quadrant, hypertrophied pylorus may be palpated. Laboratory findings hypochloremic, hypokalemic metabolic alkalosis with elevated bone secondary to dehydration, plain abdominal X-ray typical show enlarged stomach and diminished absent. Case in the intestine barium GI series shows string sign caused by barium moving through an elongated constrictive polar stenosis, projectile vomiting, constant hunger, olive-sized mass, visible peristalsis, dehydration signs, change in urination. Velos or failure to gain weight, metabolic alkalosis, irritability, lethargy, physical examination, ultrasound blood test, projectile vomiting, prompt medical evaluation, dehydration, electrolyte imbalances, surgical intervention, pleural stop, myotomy, obstruction, creative excellent prognosis.